Hey guys, this is Curtis Alexander, curtis-alexander.com. I'm a pharmacist. In this video, I'll be covering citalopram, reviewing it. We'll be going over what it's used for, warnings. If you notice from the board, a lot of warnings on this one, and I want to cover all of them. Will they all happen? No, but it's good for you to know about them. We'll go over dosing, some of those things, but I just want to hop right into it. So, like I talked about, citalopram is an antidepressant. It is a selective serotonin reuptake inhibitor. So I made a video about comparing Zoloft and Prozac. Citalopram's in the same class. And its end result is, as the name implies, it's going to stop your body or inhibit your body from reuptaking serotonin. The end result is you get higher blood levels of serotonin. Okay, so it's used for that reason for depression. What we don't use it in is pediatric patients, young patients, particularly less than 24. I'll get into that in a second. Dosing, I prefer to dose way on the lower end. I've seen higher doses. I don't like it. I encourage starting out with 10 milligrams, increasing to 20 if needed. You have to give it some time. Antidepressants are notorious. You have to give them 4 to 6 weeks before you really start noticing a difference, so don't increase them too soon. But particularly be careful in higher doses with over 60 years of age, hepatic impairment, or drug interactions. Even so-called, safe medications like omeprazole or Prilosec can cause bumps in citalopram levels. So with that being said, 10 to 20 milligrams is the sweet spot. The max is 40 milligrams, but I don't like going that high. I don't like seeing people go that high. Now, some just general warnings. We would look at liver and kidney disease. If you have that, you want to be careful. It can cause increased levels, again, especially in that over 60-year-old age range. And we want to caution its use in seizure disorders. Now I want to hop into side effects. Now these side effects are broken into two groups. There's some that are much more rare but can be very serious. And then there's some that are more common, not as serious. And so I'll try to point those out as I come across them, okay? So first and foremost, we can see a development of manic episodes, hypomania, so low-grade manic episodes. We don't know who this will happen to, why it happens per se, but some of the risk factors is if you had bipolar disease or even a family history of bipolar disease. Females are at higher risk for that. Depression with psychosis. We're also a younger age. This is coming back to this pediatric group. Antidepressant resistance. If you haven't responded well to antidepressants in the past, be careful with it, okay? We can, funny enough, you wouldn't think this, but we can see increased bleeding risk. We believe it's related because serotonin interacts essentially with platelets. Platelets are involved in the blood clotting process, so we can see some of those issues. Risk factors include, are you using other anticoagulants, an Eliquis or a warfarin, something like that? Do you have von Willebrand factor? Do you have coagulation disorders? Those are something to be concerned about. And then NSAID use, Celebrex, ibuprofen, some of these meloxicam, some of these medications that are NSAIDs, using it along with citalopram, you can see an increased bleeding risk. Another little oddball you wouldn't think is fracture risk. We don't know why per se, but as far as the actual percentage, after 1 year of use, we can see an increase in 2.9%, 2 years of use, 5.4%, all the way up to 13.4% increase in fracture risk after 5 years of use. Again, pretty much related to the long-term use, okay? You need to watch your sodium levels, okay? This is called inappropriate ADH secretion. So ADH is an antidiuretic hormone, and it's involved in that whole process. So if you are of an older age, female, if you're taking diuretics, hydrochlorothiazide, furosemide, those sorts of things, if you have a low body weight, if you already have low sodium levels, or if you're volume depleted, the bottom line is you want to make sure that you're getting your sodium levels measured while you're on citalopram. Ocular, we see this in some of the other selective serotonin reuptake inhibitors. We have ocular or eye side effects that we worry about. The main one being acute closed angle glaucoma. We can see that again in females. Again, the age is even lower this time, over 50 can be a risk factor. Inuit population, Asian population can be at higher risk. And if you have a family history of glaucoma, something you want to be careful of. Now, serotonin syndrome, this isn't as surprising. It can be a little more common because we're increasing serotonin levels in the body. You can get serotonin syndrome. It is dose related. It usually starts pretty quick. It usually starts within the day. And that includes if you're starting citalopram, or even if there's a dose change, you want to monitor people when they do this. And then other serotonergic drugs, which are mainly what are called MAOI inhibitors, not used a lot anymore. But serotonin is something that you see on occasion. QT prolongation, this is one you want to be careful with. Okay, so QT, if you're not familiar, when you get an EKG, there's an interval in that EKG. It's called the QT interval. Well, when we see changes in that, it's heart issues. So we want to be careful. And the groups that we really want to be careful in, again, older age, 65 or older, is there structural heart disease? Do you have electrolyte disturbances? How about your sodium, your potassium, your calcium, those sorts of things, okay? Liver or kidney disease, because again, a lot of these electrolytes you're clearing through your kidneys, substance abuse, and other drugs that prolong the QT interval. I harp on this a lot in videos. When you get a medication, have your pharmacist run a drug interaction check, because there's so many interactions that can occur. And there's other drugs that can do this QT prolongation. Sexual dysfunction, people don't like to talk about this, but it happens a lot in a number of medications. Citalopram is known for it. It's known for it in men and women. A big part of the reason why this can include erectile dysfunction, low libido, those sorts of things. And it happens because serotonin can actually affect some of your other hormones, including testosterone and dopamine. So again, this is one of these little more common ones, okay? Suicidal behavior or thinking. This is a big one, and we're looping back to what we started with in the video, which is in short-term studies, what they found is that from kids to 24 years of age, there is definitely an increase in risk. Once you get to adulthood, 24 and beyond, it tends to even out. And then in the older group, they saw a decrease in suicidal ideation. So the moral of the story is extremely careful of using this. Can it be used in kids? In rare circumstances it can, obviously with the doctor, psychiatrist evaluation. Not something you like to see done because it does increase the suicide risk in that age group, okay? Also, a history of depression in that age group is a risk factor for this worsening, all right? Withdrawal. This can happen. It happens in all the SSRIs, happens in pretty much all the antidepressants. Okay, so when you are on citalopram and you've been on it for 3 weeks or more, you want to, if you and your doctor decide to stop it, do it slowly, okay? Otherwise you can get dizziness, fatigue, headache, chills. Did dizziness twice. I guess I wanted to emphasize that. The moral of the story is you're going to feel like crap. You're going to feel like you got hit by a truck. You know, fever, chills. It's not pretty when somebody's withdrawing. So just be aware that if you and your doctor decide to stop, go slow, all right? And the reason, again, people fail to realize serotonin affects other neurotransmitters, other systems in your body. So when you stop reuptaking serotonin, when you stop that process and serotonin increases, and then all of a sudden you pull that process and serotonin plummets, it's also affecting things like glutamine, dopamine, and your HPA axis. HPA is involved in a lot of things, so I'll stay away from explaining that one. But we want to go slow. If somebody's on a high dose long term, really go slow. And if you've ever had issues withdrawing from an antidepressant before, be very careful, okay? And now some of the just more run-of-the-mill, very common, maybe not as serious. We're looking at nausea, 2 out of 10 people roughly. Same thing with dry mouth. And again, drowsiness, almost, we're at 18% with drowsiness. So citalopram, very common antidepressant. You see it used a lot. I would encourage, if you're going to start on it, talk to your doctor about starting at the lowest dose possible. Increase slowly and only if you absolutely have to. It just comes with a lot of warnings, a lot of potential side effects. Some of them more common, not as serious. Some of them less common, but can be very serious. So I feel like it's just kind of thrown out there willy-nilly too often and not given enough consideration into the downsides of it. So if you've taken citalopram, let me know in the comments, what was your experience? If you've known anybody else who took it, what was their experience? It helps me. It helps other people watching the video. So I hope this video was helpful and valuable. And until the next one, this is Curtis. Thanks.